My name's Lesley Dean, I'm 42 and I come from Maidstone in Kent. I'm a wedding and honeymoon specialist for a small independent travel company, and that basically involves arranging people's weddings in luxurious destinations such as Mauritius, Seychelles and the Caribbean islands. Lesley speaking, how can I help? I had my gallbladder removed about 2 years ago now. I was on holiday in Portugal when I first noticed the symptoms. I'd been on a low-fat diet and I've since learned that this actually can trigger gallstones. I started being very ill, like a very bad indigestion and throwing up, being very sick, a lot of pain. I went to see my GP and he suggested I went for an ultrasound. I mentioned to him that we had private healthcare and he said that that was fantastic because then he could arrange for me to go for a scan probably the next day. So he faxed the information, I phoned them, and I literally did have the scan the next morning. It was then arranged that I would go and see a consultant, so I also had my choice of hospitals. When I first met the consultant, he was very informative. He tried to do it in layman's terms, so he tried to make it very kind of understandable for those that don't have a medical degree. So it involved drawing pictures and all that kind of thing, but I could have as much time with him as I wanted. He was able to tell me what would happen with the operation, and also I could arrange the date. When I arrived at the hospital, obviously you're met, you're taken to your room. They kind of show you how everything works in your room. They bring you in your gown and of course your lovely socks that you have to wear. It's a bit like checking into a hotel because it's a bit like a boutique hotel. Everyone from the receptionist to the porters, to the lady that takes your menu, just everyone's so pleasant to deal with that, you know, it's a pleasure being in hospital really. If there's something on the menu you can't eat, especially when you're having a gallstone operation, then there's always salads and everything that they'll make for you for your lunch and for your tea. When I went down for my operation, I remember walking down to the theatre, getting up onto the table where they prep you and they put the kind of heart monitors on you. And then the anaesthetist comes in and the assistant was kind of helping, saying, you know, do you like cocktails? We're now going to give you an amazing cocktail. And I remember the mask coming down over my face, which they told me smelt like vanilla. And then I woke up after the operation. I know it was keyhole. And yeah, I've still got 2 very, very small scars from the operation. So it's a very neat job. After the operation, I was in fact asked if I would like my gallstones. So I thought, why not? And here they are, the little things that caused me so much trouble. After the gallbladder operation, you don't have a pain, but obviously because you don't have the gallbladder, you have to be a little bit careful what you do eat because the gallbladder is there to break down fat. So you just keep it healthy in salads and a little treat occasionally. About 2 weeks after I'd had the operation, I went back to see the consultant, and that's when he gave me a few more days off work where I was told to completely rest and not work. And then I was allowed to actually drive and go back to work. The beauty of actually having private healthcare is that you do see the same consultant every time, and that really makes you feel confident and very comfortable.